Hey YouTube, it's Marita and welcome to another edition. On today, if you saw by the title, we're going to talk about something that's very serious that people kind of take lightly. But being an OB nurse and being that feminine hygiene is a big deal, especially after having a baby, I want to talk about feminine hygiene postpartum edition. So if you want to see what I'm talking about, you definitely got to stay tuned. All right, so we're going to jump right in. I don't have any notes with me. I'm just going to kind of go basically off of kind of how I do my discharge teaching when I'm teaching patients about their, not discharge teaching, but their patient education regarding feminine hygiene. So as you all know, or as you probably think, that most women would know how to keep themselves clean after having a baby. But truth be told, I've ran into so many different patients as well as nursing students who have no clue about how to keep themselves clean. So this video is strictly about feminine hygiene, but after you have had a baby. So this is what I tell my patients. This is what I teach my nursing students. And now we're going to talk about it here on YouTube. So first and foremost, let's talk about what is going on in terms of when you are having a baby. So as you all should know, babies come out either one of two routes, okay? They either come out vaginally or they come out via C-section, where they actually cut the abdomen, cut the uterus, get the baby out that way. Typically done, obviously not typically, always done in an OR, but at the end result, you're still going to bleed either way. And a lot of women don't understand, a lot of my patients really don't understand, why is it that I bleed after I have a C-section? And you bleed because you have placental detachment. So when that placenta detaches from the uterine wall, it creates a wound, so to speak. And as you know, a wound bleeds and it heals. Now, mind you, just think about if you had a cut on your hand, a good gash on your hand. What's going to happen? That same response, so to speak, is going to happen when you you're going to bleed, obviously, and then eventually it's going to clot off, form a scab, and then it heals, right? So it kind of mimics that same mechanism if you had a gash in your hand or any other part of your body, except for it's the uterus on the inside of a woman's body. So the placenta detaches, it creates a wound. That's where the bleeding comes from. So if you have a C-section or a vaginal delivery, you're still going to have a wound there and you're still going to bleed regardless. Now, mind you, there are certain things that doctors can do in terms of irrigate you or clean you out, where you don't bleed as much after a C-section while they're already in there. But let's just, for the sake of the video, just understand that everybody is going to bleed after having a baby. So with that being said, it's now time to keep yourselves clean. So I have a lot of nursing students who believe that just because they practice their feminine hygiene in a certain kind of way, that is true for every single woman. Keep in mind that women have to be taught, and they're taught typically from either their mothers, their grandmothers, their sisters, their aunts, their cousins, sometimes even friends. But as with anything else in life, we're not always taught the same thing. We're not always taught correctly as well. So here I'm going to just basically talk about some feminine hygiene practices that you need to tell your patients or students if you're an educator, or maybe you are a patient yourself, someone you just had a baby, you're watching this video. This is for any of those situations in which you know how to keep yourself clean after having a baby. So the first thing I always tell my patients is, for one, we need to make sure we're going to the restroom every 2 to 3 hours. For one, not only to empty our bladder, keep our bladder emptied, but also to change our pads. You cannot wear tampons after you have a baby. That's a no-go. So you have to wear pads for the first about 6 weeks or so. After you go to your postpartum checkup and get checked over, and then you have a period again after the fact, then you could go resume tampons if that's what you wear. But for the first 6 weeks, everyone has to wear pads. Excuse me. So we want our patients to change their pads. Excuse me. We want our patients to change their pads every 2 to 3 hours around the clock. So I tell my patients, you have to get up in the middle of the night before you feed your baby. You're going to get up, you're going to go to the bathroom, you're going to wash your hands before you touch yourself. Wash your hands. You're going to, and I'm going to go step by step, because believe it or not, there are women out there who, when I go and get my patients up or say, you need to go to the bathroom, they're looking at me like, oh, so what do I do? And I'm kind of like in my mind, like, what do you do, or what did you do when you were on your period? So it kind of has me thinking like, okay, are they not educated, or they're just scared because there's maybe stitches down there, or what's going on? So I'm going to take you step by step, like I take my patients step by step and my students step by step. So basically, you're going to take off. Obviously, you're going to go use your restroom. You're going to pat dry. So get you some tissue and pat dry. If you have stitches down there, you are not going to rub anything anyway, but you're going to pat dry. Make sure when you're wiping from front to back, because you don't want the bacteria from any fecal material to get into the urethra and cause you to have a UTI. So you're going to wipe from front to back all the time. You're going to, well, let me back up. I missed a few steps, to be honest with you. You're going to, no, I think I was right. You're going to pat, and then you're going to wipe from front to back. After you do that, no, I did miss a step. So there's this thing called a peri bottle, and for most postpartum women, it is like their best friend. They love it. So this peri bottle, so after you take your pad off and dispose of that, properly wrap it up and put it in the trash can. Then you're going to basically take that water bottle. I forgot about that water bottle. And I've heard nurses say cold water, but I don't know anybody who likes cold water down there. I think warm water is more soothing to your bottom, or the vaginal area and the perineal area. So you're going to take a water bottle, the one that they give you, or we call the peri bottle, and you're going to put it, my preference is warm water, but you put what you like, lukewarm, warm, hot, cold, whatever you like, but warm is usually the most soothing. And you're going to fill it up with water, and you're going to rinse the perineal area off. So make sure, let me back up. Let me back up, because I am really ahead of myself. All right, rewind. You're going to take your pad off, dispose of it properly. After you pee, because you should be in the bathroom peeing to empty your bladder, but if you didn't have to pee, then you're going to take your water bottle and you're going to spray or rinse off down in the perineal area. So with that being said, you know, some people who have had stitches down there, so they have stitches to episiotomy or laceration, so they have to stitches to stitch them back up again. And I'm talking about vaginal deliveries at this point in time. Sometimes it helps if you take that water bottle and as you are peeing, spray down there, and that actually helps soothe or dilute the urine, so that when you're peeing, it doesn't burn as bad. So I always tell people to take your water bottle while you're peeing and spray at the same time around, you know, obviously where you're peeing, so the urethra area, and it dilutes the urine, so therefore, or the perineal area, so therefore it will not burn as bad. So after you spray, if you do have stitches, some people use topical like Dermaplast spray, or some people even use Tux, witch hazel pads, or whatever your topical that you're going to use. Go ahead and either spray or use that topical to kind of soothe that area. And then if it's a topical, some people actually leave it in their pad, or some people dispose of it, whichever one is good for you. But you're going to do that, and you're going to then, you know, put your cling pad on, and then you're going to pull up your panties and, you know, go wash your hands and so forth. Now, that's just how you keep yourself clean regarding it's just time to go to the bathroom. Now, what about when it's time to shower? So when it's time to shower or to bathe, you know, I have to tell people how to wash that perineal area. And one thing that they are not, you know, they're used to having their Bath and Body Works products, and I strongly advise against using Bath or Body or Victoria's Secret soaps or scented anything in the vaginal area after having it, really, period, but after having a baby especially. And the reason being is because, for one, you have all that moisture down there, you're bleeding, and you typically just don't, you know, you get easily irritated. So you need to have products such as either Dove, you know, a unscented Dove, Or some people are able to use the feminine hygiene, like the Summer's Eve's feminine wash, or Vagisil feminine wash, or whatever brand you use. But they are using either the Dove or they'll use the feminine wash, and make sure the feminine wash is unscented. Those fragrances, those perfumes, those things like that, even though it says this pH balance for feminine health, some people are still very much sensitive to that type of thing. So you want something, especially after having a baby, that's going to keep you clean, that's also going to keep you not irritated. So that's something you're going to use to wash with. Now, there's one thing that I think some women don't quite understand. And the thing that they don't understand is lochia has an odor. Okay, so lochia, like menstrual blood, they're not the same thing. Lochia is the bleeding that you have after having a baby. Menstrual blood obviously is when your endometrial lining sheds from not getting pregnant. So those two things, the mechanisms are the same, but the odors are very different and they're very distinct. And with that being said, even if you're not on your period, you're not bleeding at all, you still should be keeping yourself clean. Women cannot go no longer than about 24 hours or so, if that long, without washing. Okay. And so I have to tell my patients that you have, there's times where I have to tell my patients, I can walk in the patient's room and know that she needs to take a shower. And so I'll basically say, hey, after you take your shower, I'm going to give you your pain medication. I just say it just like that. That's my way of getting them to get cleaned up, because the smell can be kind of offensive, especially if they're not clean. Keep in mind, people come from all walks of life. So it's not like you and I where we can go to the store and get our products as we need. I have met people who they don't have the ability to go get products. And so therefore they're rationing things or rationing pads. So they're waiting till the pad is soaked before they change it. That sounds nasty, but that is the reality of the people that I see. Think about the homeless population. Do you think they can go change every 2 to 3 hours? Well, guess what? The homeless population also gets pregnant. And when they get pregnant, they're going to revert back to their ways of doing things to ration their products like they would if they're on the street. So when that's going on, you want to make sure that you teach your patients that you have to stay clean. We want you to wipe from front to back. We want you to change your pads every 2 to 3 hours. Give them an extra pack of pads to go home or to go wherever they're going to go, a shelter where they're going to go. It's not your stuff anyway. And if you know there's a need for the patient, give them what they need. So again, just to recap, you want to make sure you teach your patient, change every 2 to 3 hours, wipe from front to back, use your peri bottle to rinse off, pat, dry, use your spray topicals such as your Dermaplast or your witch hazel for the perineal area. Then when it comes to actually showering, you want to make sure that you use a Dove that's unscented, or some people use Ivory, and then other people use feminine wash products, but try to make sure that those are unscented as well so they don't irritate you. Also, when it comes to the hygiene, I tell patients if you have stitches down there, they're going to heal. And when they heal, anything that heals will itch. So people who have stitches in their perineal area will itch in about 2 to 3, usually about 2 weeks or so, because it's healing. And I tell them, do not try to get down there and claw at it. Just know that it's an uncomfortable feeling. It does itch. And the best thing to do is to use your water bottle, your topical sprays, or your witch hazel to help soothe that area. But do not go down there and try to scratch the area where the stitches are. I know that sounds like, who would do that? But people do that. I wouldn't tell you anything that I haven't seen at the hospital or heard when I follow up on patients postpartum wise. So hopefully this video has been helpful for you. Oh, one more thing that I missed. For some reason, women don't understand that we have a natural odor, and that odor is supposed to be like it's supposed to be. I'm not talking about a fishy odor. I'm not talking about a hygiene odor. It's a natural odor that women have, okay? And actually it's more of a pheromone, and that's why men typically like how women smell. So with that being said, it's supposed to be there, okay? That scent's supposed to be there. So some people don't understand what you're actually supposed to be washing when you're washing. So I wanted to make sure I address that too. So just so you know, the actual vaginal area is on the inside. It's inside. What we see on the outside is called the vulva. That's the part that you actually wash. So you're washing from the mons area, which is where the pubic hair would be if you had pubic hair, or if if you've already shaved that area. That will help cut down on odor as well as if you shave that area. But the Mons area, all the way back where you see the labia and things like that, is called the vulva. That is the part we wash. That is the part that you put your soap on your rag and you take it and you wash down there. Nothing goes inside the vaginal opening where the baby came out, if it came out that route, or where you place your tampon. Nothing goes in there to keep that area clean. It cleans itself. So you don't have to put anything in there. You clean the outside, not the inside. And again, you're supposed to have, even when you're not, when you're not bleeding, you're going to have a natural smell. So be mindful of those things. That it sounds like it's something that it's very elementary, and it's not. It really isn't. I have a lot of patients who truly do not know how to keep themselves clean. And on that note, I typically have C-section patients. Now, this is what gets me. So my C-section patients, we get them up for the first time at my facility about 12 hours post-delivery. And when we get them up to go to the bathroom and do their own peri care. Now, we as the nurses did their peri care for them while they were laying in the bed for those first 12 hours. So every about 2 to 3 hours, I would go in and cleanse their bottom and get them fresh pads and everything, chucks and everything they need underneath them. But when we get them up, that means we are now delegating the care to themselves, where they're doing their own peri care. So mind you, when you've had a baby, you still have a belly. Most of us still have a belly after we've had a baby, kind of like a hollowed belly. The baby is out now, but the shape and everything is still pretty much there. And you are smaller than you were before the baby was in there, obviously, but the thing is you still have a belly. So when you have your C-section patients, as an example, they're like, well, they always tell me, I can't see it. And I'm looking at them like, what do you mean you can't see it? What do you do when you're in the shower? What do you don't have to see it to clean it. We all typically know where the anatomy is. We know where our vagina is. So therefore you just, reach down there and wash it. So sometimes, those are some of the I wouldn't say dumb, because I'm hearing it a lot. Like, I can't see it. I can't see it. I can't see what I'm doing. You don't have to see what you're doing to clean it. Whatever you were doing when you take a shower normally, that's how you still wash it, so just wash it. And they kill me with that. And I'm like, just put your hand down there. You know what everything feels like. Just wash and carry from there. So you will hear things like that. I can't see it. Or, I've had women who, when they have their baby, they don't realize that they're going to continue to bleed for up to 6 weeks. So they're sitting on the toilet and they're wiping and wiping and wiping and wiping. And I'm like, okay, you can go ahead and put a pad on. We've been in the bathroom for like 20, 25 minutes just wiping. And they're like, well, the bleeding won't stop. And I've had to explain to them, the bleeding's not going to stop for about up to 6 weeks. So this is just like your period. And I tell them, this situation is exactly like your period. When you go in and you wipe, you're getting clean for the moment, okay? And then after that, it's going to continue to flow, if you will. And in 2 to 3 hours, you'll get up and change your pad again. And so they're like, oh, I didn't know that I had to do this. I thought that it was going to be done. No. Again, a lot of what we do in postpartum is education, education, education. That's the biggest thing I do in postpartum, is teaching them how to care for themselves as well as the baby. So again, these are just tips for you to help you if you are a patient, or you if you are a student nurse, or you're a nurse but you're not an OB, or maybe, you are a nurse who happens to be pregnant or having a baby. You have to keep yourself clean. And you need to change your pads every 2 to 3 hours. You need to wipe from front to back to prevent UTIs. You need to use your peri bottle, or I recommend you use your peri bottle. Most people like it. You need to make sure that you are using your topicals if you need them. So if you have stitches down there, if you're swollen down there, if you are, we give ice packs to our patients if their labia is swollen. We give ice packs if they have hemorrhoids. That whole area back there is just kind of tore up, so to speak. So we give them ice packs and we give them topicals, and we do sitz baths where they'll go and sit on this thing where water will spew up and kind of cleanse the perineal area. And we recommend doing that every usually 2 to 3 hours, or 3 to 4 hours. At our facility, we've kind of moved away from sitz baths. I'm not sure if it's a physician thing, or really the patients really don't like it, so they really don't use it. We use our ice packs mostly, our topicals, such as our Dermaplast spray, and we use our witch hazel for that area down there to help soothe that area. So make sure you're teaching your patients correctly about how to keep themselves clean after having a baby. If you have any topics that you would like me to talk about, I am going to do one on the entire postpartum assessment, but I wanted to take this part of it out, the feminine hygiene part out, because it's its own topic in itself. So teaching your patient how to make sure she keeps herself clean is very, very important for her feminine health, obviously, and then just to help her heal from the whole postpartum process. I tell people, you know, when it comes to OB or postpartum specifically, the only area I really care about is from the fundus down to the vaginal area. Everything else is important, obviously. I need to know what your vital signs are. I need to know, you know, what your pulses are in terms of, do you have pulses, how circulation is. I need to know all that, but at the end of the day, postpartum, the only thing I care about is the fundus and the vaginal area, what's going on down there, or if you're a C-section, what your incision looks like. So again, if you have questions or something you want me to talk about specifically regarding postpartum care, then, you know, leave a comment below. If you're wanting something related to OB or any nursing topic, leave a comment below, or you can DM me on IG. If you have a question or concern, if you have a question about nursing school, again, DM me or leave a comment below. Whatever your qualms are, questions are regarding school, OB, nursing in general, let me know, or even education, because I am a nurse educator and I'm actually in school myself to get my doctoral degree. And so if you want to know about my journey, anything regarding that, just let me know. Hopefully this has been insightful. Hopefully something that you can take with you to clinical. For those of you who are about to do OB rotations, or when you do your OB rotation, you'll know how to properly educate your patient on how to do her perineal care. Again, for yourself, if you happen to need it, or maybe you just did know some things. I've met people who just did not know. Keep in mind though, you know, keep in mind, I'm reiterating this fact. Keep in mind that a lot of your patient population may not be like you. They were not raised the same way you were raised. They don't know what you know. They didn't have someone, a mother or a female role model, to teach them how to keep yourself clean. So you will see, and I have seen patients who literally will take a pad and wear that pad from tip, I mean, it'll be blood on it from tip to tip. So when you're doing your peri assessments and you're looking at their pad and their vaginal area, make sure you're wearing your gloves, okay? Your PPE, make sure your gloves are on when you're doing that kind of thing. And honestly, I put my gloves on as soon as I start my assessment, so I don't stop and take time to put gloves on. I actually come into the room, I get my vital signs, I'm putting gloves on before I take my vital signs. That way I can jump right into my head to toe assessment, and when I get there, my gloves are already on. So I've met people, again, who are homeless. Again, think about what it's, if you don't know, because you never experienced it, think about what they probably go through. I'm sure you've traveled in your city and seen the homeless population, and there's women in there who are pregnant, and they, again, cannot get to a bathroom every 2 to 3 hours to change a pad. So don't be judgmental in the sense of like, oh my gosh, I can't believe she's so nasty. We do have some just nasty women out there who have access and the means to get what they are. They're just nasty women, possibly because they haven't been taught. Again, I've met people who are very clean women in general, but they did not have the money to buy their products. So do not judge these people if they can't afford to buy their feminine hygiene products. That's why I send them home with extra pads and extra sprays and things to get through them, you know, maybe through the next month or so until they can get some more products. That's the reason why it's important for you all to donate to your women's shelters, because what do they need? They need feminine hygiene products for these women. You know what you go through every month when, if you are still having your menses. Imagine going through that and being homeless. Imagine not having access to a bathroom. I personally have OCD. So with my OCD, there are certain bathrooms I just won't even use. I'll just hold it till I get home or whatever. That's not good. I know that. But at the same time, I do have access to bathrooms. I choose not to use them because they're nasty. But these women have no choice but to use whatever they can use. So, you know, I highly recommend you, if you can donate, find you a shelter, a women's shelter to donate to, or, you know, just be understanding that if you're a nurse and you're working in a hospital, especially in OB, that they do not come from your walk of life. They don't think like you think. They don't talk like you talk. There could be different cultural reasons as to why they don't do certain things. Some people believe that the bleeding is a cleanse thing. So therefore, I've seen people who are free bleeders, meaning that they don't wear pads or anything. They just freely, that they freely bleed. And for me, that don't work. I need something that's going to collect all this stuff and I can dispose of it properly. Speaking of disposing, make sure you teach your patients how to dispose properly of their pads. They do not go in toilets. Okay, you can clog up the whole system. And you know, at your hospital, they don't go in toilets. You wrap them up the same way as you should be wrapping up your pads at home, the ones who use pads. So you're basically going to, you know, take the pad and personally, I was taught that you wrap it up with tissue and you put it in the trash can. However, that's how we do at home. At home, we don't also have a red bag, you know, a red trash can or a red bag in our homes. So in the hospital, you can just take the whole pad, just toss it in the red bag, in the red trash can. That's usually in the bathroom. If they don't have a red trash bag in there, then well, some hospitals don't. I've actually been to a hospital that they just had regular trash cans in the bathroom. In that case, you would wrap it up properly and just dispose of it in the trash. But at our hospital, we have red trash cans, red bags, the biohazard bags in the bathroom, and that's kind of where all the pads and things like that go. So, you know, I've had patients who will take their pads and just throw them on the floor. I've had patients who was passing clots, and clots, that's a good thing. So, you know what, I'm gonna do another video on that. That's kind of like postpartum complication type stuff. So I think I will wait another video on that one. But anyway, they will have clots and they will sit there and have the clot in the middle of the floor. Or they don't flush the toilet. Just nasty, nasty, nasty. So you always make sure that you know, tell them they need to get their pads and dispose of them properly. And whatever that means at your facility, that they do that. And I'm not one to come in and clean up your room and throw pads and stuff away. You know, you got to do that yourself. And I tell my patients, you need to, you know, after you take your pad off, dispose of it in the proper receptacle. So anyway, thank you so much for watching this video. If you're new to my channel, my name is Marita and I am a registered nurse. I've been a nurse for 15 years. I'm an OBGYN, well baby nursery nurse. I'm also a nurse educator. I've been a nurse educator for 13 or so years. I am currently on my doctoral journey with 281 days left till graduation. I'm excited about that. So if you are new, definitely subscribe, hit the notification bell so you know the next time that I upload. Also, if you look at the YouTube banner up there, you'll see 2 IG pages. One of them is my page, my Melanin RN page for nursing. It's my personal blog, but it's also nursing related mostly. I have another one that is for plus size fashion, makeup, plus size fashion, and then makeup, beauty, things that ties into that. I love to wear makeup. I love fashion. I love everything about being who I am. I love being black. I love being everything about who I am. So if you want to follow me on that page, go over there as well. Again, anything you want to leave in the comments regarding videos that you want to see regarding either or, then definitely do so. I do make videos on fashion, beauty, makeup, things like that, or things that I'm into. So you'll see a little bit of everything on this channel. But until the next time, you all take care. Bye-bye. Let it loose, let it go.